Herpes viruses are enveloped, double-stranded DNA viruses, and one feature that they all really seem to have in common is this ability to establish latent and recurrent infections. So these are infections that you're going to get, you'll experience primary symptoms, and then later the disease will come back, it will recur. Herpes viruses are fairly large and they do have pretty large genomes, so they can encode a lot of different proteins, including proteins that help them to manipulate the host cell and to manipulate the host immune response. They have their own DNA polymerases that they bring with them that can promote their replication. But remember this idea that if a virus brings something with it, or if it has its own specific enzymes, those can sometimes be good targets for antiviral drugs. So the herpes viruses are a group of viruses for which we do have some antiviral drugs. These do not necessarily lead to clearance of the infection, but they can prevent recurrence of the infection. As DNA viruses, you probably would imagine that the replication of the virus occurs inside of the nucleus. And you see that the virus, because it's an enveloped virus, can often be released by exocytosis. It can also release through cell lysis and through cell-to-cell bridges. We can have lytic, persistent, latent, and even immortalizing infections. So one of our herpes viruses, which we'll talk about, can cause cancer. Herpes viruses are everywhere. They are very, very common infections. And in order to have good control of the infection, you have to have a good cell-mediated immune response, so a good T-cell-mediated immune response. But that T-cell response can also lead to some of the symptoms that we see with herpes virus infections. So our major herpes viruses are listed here. We are not going to talk about all of these herpes viruses. Specifically, we will talk about 1, 2, 3, 4, and 5. But for example, you may have heard of herpes virus 8, human herpes virus 8, which is causes Kaposi sarcoma. If you've ever seen the movie Philadelphia with Tom Hanks, he takes off his shirt and he has all these lesions all over his body. Those are Kaposi sarcoma. This is a relatively uncommon manifestation of disease in our healthy patients, but it is one of the first signs that a patient has progressed from HIV to AIDS. So that's a fairly common manifestation in AIDS patients. Again, herpes viruses, large enveloped DNA-based viruses. Here we have a cross-section cartoon showing the viral envelope. Of course, we will have some viral glycoproteins that will help with attachment to host cells. And we do know that various herpes viruses exhibit tissue tropism. We actually can see on the slide here in this table the site of latency. So there are particular tissues that these viruses will hide in, neurons, B cells, T cells, but also they have primary target cells. So where do they first go when they get into the body? So herpes viruses 1, 2, and 3 will go to the mucoepithelial cells or your T cells. Some of the others will go to different immune cells like B cells or lymphocytes. So depending on the virus, they will go to different parts of the body. When they get in, there are 3 phases of transcription. So first, the immediate early genes being transcribed are going to be those to regulate transcription and to take over the host cell. Then the early genes being transcribed will be the other transcription factors and their various enzymes. Finally, their late transcription is going to be the structural proteins to put together the capsid and those glycoproteins to embed in the envelope. When we have a situation where some of the genes might be being expressed in a host cell, but we're not actually getting replication of the genome and therefore replication of the virus, that's when we have a situation called latency. So what ends up happening is that as the cell replicates, or, with a neuronal cell, as the cell just kind of sits there. The virus doesn't replicate itself, it hasn't taken over or anything, and it just kind of waits. And what it waits for depends on the different viruses. The first two that we'll talk about are the herpes simplex viruses caused by herpes. These are herpes virus 1 and herpes virus 2. They are what we generally refer to when we say a person has herpes. This is what we're talking about. Herpes means to creep. I guess you could think of it as the lesions from a herpes infection kind of creep up on you. So that's what it means. There are approximately 80 proteins in the herpes simplex viruses. And because many of them are unique and they are like herpes virus specific, they can make good drug targets. So again, we've talked about this a little bit, that the herpes simplex viruses, we do have treatments available, not that necessarily cure the infection, but again, that prevent outbreaks or recurrence of infection. These can infect most human cells, and whether or not we get a lytic or latent infection depends on the cell type. So remember, the mucoepithelial cells are going to be the target for the primary infection. These are the types of cells where you're going to experience a lytic infection. Whereas neuronal cells, we tend to have latent infection. The two herpes simplex viruses, 1 and 2, are similar in a lot of ways. They do, however, differ in their growth characteristics and in the antigen profile that they generate. So they will lead to different antibody responses in the host. Herpes simplex virus 2 is one that's more likely to cause viremia, or to get into the bloodstream and travel throughout the rest of the body. Again, we have a lytic infection in the majority of cells that it will infect. However, we see a latent infection in our neurons. What happens is host cell lysis will result because the virus has taken over all host function. So we lose the production of host cell macromolecules. That leads to death of the host cell. Microscopically, you can see lots of inclusion bodies in the nucleus because the capsid proteins get transported into the nucleus for packaging the genome. And also you'll see syncytia, those giant multinucleated cells. The lesions that we see in patients who have a herpes simplex virus outbreak are due to a combination of the viral effects on the cell, like leading to host cell death, or the syncytia, or things like that, and also host pathology. So remember, I told you that the T cell response is really important. And so the idea that you have T cells, that cell-mediated immunity, going in and killing infected cells, well, you see cell death leading to lesions. The fluid that comes out of the lesions is infectious, and it contains infectious virions. So because we have these CD8 positive T cells, these like the cytotoxic T cells, and we have interferon gamma, which is a pro-inflammatory cytokine, those will help promote latency, because what they'll usually do is lead to death of cells that are producing viral proteins. So when we're starting to replicate our genome, the CD8 positive T cells, that interferon gamma, they're going to lead to that inflammatory response to kill the cells that are actively infected. So they will control and keep cells latent. So they don't let the infection progress. When you have a situation where patients begin to have a decrease in their cell-mediated immunity, or even a temporary suppression of cell-mediated immunity, at that point, the infection can then become lytic again, and the patient will have a recurrence of lesions. What we generally see in our patients who have herpes simplex virus infection is, again, the viral infection is maintained in the neurons, and when it is going to go lytic again, it will transport down the neuron to the epithelium, where it will then replicate and cause that lytic type of infection. So I mentioned that it's really important to have these CD8 positive T cells, to have interferon gamma and this pro-inflammatory type of response to prevent the development of a lytic infection. So what leads to a loss of cell-mediated immunity and what leads to a loss of that inflammatory response, therefore potentially leading to a recurrence of herpes simplex virus? Most of us are probably thinking, well, if you're immune suppressed, so some sort of medical treatment, perhaps another type of infection, but you'd be surprised what really can lead to immune suppression in your patients. Things like ultraviolet radiation can be a trigger for a lytic infection. Fever. Often when patients have the oral manifestation of herpes simplex virus, around the mouth, we call them fever blisters. Stress, emotional or physical. Final examinations, a big date. Can you even imagine, you're so excited, you're going on a first date, you just really like this person, and you're really looking forward to seeing how things go. Bam, herpes. Right? That's horrible, but that's what happens. Menstruation can cause it. Spicy or acidic foods or food allergens can trigger that localized lytic infection. And then, of course, immunosuppression. So that transient or stress-related immune suppression, chemotherapy or radiotherapy, and then, of course, things like HIV, which cause secondary immune suppression. So once you have it, you gotta keep on an even keel. Don't go tanning. Just try to be calm. So the fact that it is latent does lead to the potential for lifelong transmission. However, the fact that it has an envelope makes it sensitive to inactivation. So we're not talking about you sat on a toilet seat and you got herpes. That's not what happened. So if somebody tells you that story, that's a lie. It is, however, transmitted in saliva, vaginal secretions, any contact with the fluid and another mucous membrane. So if the fluid comes in contact with your intact skin, it's not going to happen. If you have secretions or saliva, that's where the virus is going to be. So it can be transmitted orally, through kissing, or sexually. It can also be transmitted by placement into the eyes or breaks in the skin. So again, we are not talking about something that you happened to touch somebody's fever blister with your finger. You're not going to get herpes on your finger unless you have maybe a cut in your finger instead. Generally, we consider herpes simplex 1 to be oral herpes, while herpes simplex 2, which is the one that's more likely to cause viremia, is generally considered to be the sexually transmitted version. However, this is not an exclusive delineation. Both herpes simplex viruses can cause oral and genital lesions. So who is at risk? Children are generally going to be at risk for primary disease of herpes simplex virus 1. This is usually going to be when an adult family member who has a cold sore kisses a baby. There's nothing inappropriate here. It's just, oh, the baby, they're so cute. Whoops. Okay. So if you ever have developed fever blisters, you get cold sores, you have herpes simplex 1, you definitely want to make sure that you don't express your affection towards children in that way, especially when you have an outbreak. Of course, sexually active people are at higher risk for herpes simplex virus 2. Anybody who comes into contact with oral or genital secretions, including in health professions, is at risk for infections in their fingers. So you always want to make sure you have intact PPE, right, your gloves, and if you have any, especially if you have any cuts or breaks in the skin. So herpetic whitlow is what you get if you get a herpes infection of your skin and other parts of your body. Immune-compromised individuals and neonates are at risk for disseminated life-threatening disease. So any of our patients who have weakened immune systems, either because they're very young or because they have some sort of immune deficiency, could potentially die of herpes. So it can be a fatal infection in certain categories of individual. It is estimated that in developing parts of the world, more than 90% of people have antibodies to herpes simplex 1 by the age of 2, meaning that they've had the infection. Neonates are generally going to be infected during childbirth. However, the virus can also cause infection in utero. And it is estimated that anywhere from 1/5 to 1/4 of adults in the United States are infected with herpes simplex virus number 2. So I am going to tell you a story, and hopefully this story will highlight for you the importance of cultural sensitivity, but also the fact that previous culturally acceptable practices may no longer be as culturally acceptable. And so in New York City, there is a area in the city where there are a number of ultra-Orthodox Jews. So they are very dedicated to practicing their religion in the way that they feel best, and it tends to be a highly conservative, very, it's not biblical because it's their holy book, the Torah, so based on their holy book, right? That's how they live their lives. One of the very common practices in Judaism is circumcision of males by, I believe, day 8 after birth. That is part of their covenant with God. In most Jewish communities that practice circumcision, it's done in the hospital, it's done 100% sterile, as you might imagine, as other families who are not Jewish would do for their infants being circumcised. However, in these ultra-Orthodox Jews, the circumcision is performed as it was thousands of years ago, and it involves the rabbi cleaning the wound from circumcision by mouth. And if you're not familiar with what circumcision is, it's the removal basically of the foreskin of the penis. So it does create a wound. In any sort of medical procedure, you would normally expect that would be, any wound would be cleaned sterilely. However, in the Orthodox Jewish tradition, the wound is cleaned by mouth. And so the situation in this community was that the infants were developing herpes. Some of them were dying, as you can see in the second headline, because the rabbi had herpes. So the rabbi had probably herpes simplex 1, had a cold sore, but removed the blood from the penis using his mouth, which I know does not sound like something that you would consider to be acceptable, but it is acceptable in their religious tradition. And these newborns were dying of herpes, a 13-day-old baby, so not even a month old. So in this situation, it was really important to be culturally sensitive, to understand that circumcision is an integral part of the way that they practice their religion, but to also educate them that the risk of performing circumcision in this particular way could lead to death of their child, which would likely not please God. And so then It was convincing the community that they can still practice circumcision, absolutely, freedom of their religion. However, be sterile when you're cleaning the wound. So it's critically important that we prevent neonates from being exposed to the virus. So herpes simplex 1 and 2, you see kind of compare and contrast here. Generally, we think of neonatal herpes infections as being when a neonate is born. They will be exposed to herpes simplex 2 through delivery, but we were seeing the virus because of a cold sore in the rabbi instead. So our common symptoms of herpes infections are going to be cold sores or fever blisters, which can look something like this. So you can have herpes pharyngitis, where it's in your throat. You can have herpetic keratitis, where if it gets in the eye, if you have a viral infection, herpes in the eye, it can lead to blindness. Herpetic whitlow is what it's called when you have a manifestation on the skin, and so you can see on this person's knuckle. And then herpes gladatorum is what it's called if you have it anywhere else on the trunk. So if somehow on the body a patient had an open wound that came into contact with infectious fluid. Infection in neonates is often fatal. They don't have the cell-mediated immunity to stop the lysis of their cells. And if it goes into the brain, that's generally what we see happen. Direct analysis of a clinical sample can be diagnostic. Of course, we can also look for viral antigens or viral DNA. And so generally what we do in this case is a patient who is known to have herpes simplex virus is going to be prescribed what are called nucleoside analogs. So nucleoside analogs basically mimic a regular nucleotide or a regular nucleoside, but they get incorporated into the growing viral nucleic acid and they prevent the synthesis of the viral nucleic acid. So it can prevent or shorten outbreaks. Washing with soap would disinfect the virus because you'd be disrupting the envelope with the detergents and soap. Protective apparel for any sort of healthcare professional, so you always want to make sure you have your PPE. Protective apparel could also mean practicing safe sex to prevent the spread of genital herpes.